Hi, my name is Morgan. In this Ignite presentation, compares and contrasts obesity in both America and Canada. When we talk about obesity, it's easy to think about food choices or lack of exercise. But the truth is, obesity is a much more complex public health issue that's shaped by environment, policy, and inequality. Let's explore how the US, Canada, and even India are facing this challenge. The United States has one of the highest obesity rates in the world, at over 40% of adults being affected. Canada is lower, at around 28%. In India, the overall rate is lower still, but rising quickly in urban areas. We'll get to India later. These numbers aren't just statistics, they reflect the health systems and policies behind them in each country. In the US, healthcare is a mix of both private insurance and public programs, but many still face barriers to access. Canada's universal healthcare system provides a more consistent access to preventative care, which helps with early intervention, especially for obesity-related conditions. Access to healthy food is also key. In the US, many low-income neighborhoods are food deserts. Canada has similar issues, but also more public health programs supporting access to nutritious food. In both countries, school lunch programs shape kids' eating habits from early on in their lives. Public health matters. Canada has invested in community health centers, food education, and policies like banning junk food ads to kids. In the US, some states have similar programs, but nationwide efforts are fragmented and often underfunded. Obesity doesn't affect everyone equally. In both countries, racial and ethnic minorities and low-income communities face higher rates of obesity. Systemic barriers like housing, education, and job access plays a role in these disparities. It's tempting to think that obesity is just about willpower or lack thereof, but that ignores the role of stress, trauma, cultural stigma, and economic hardship on people. We can't separate health from the systems people live in. Government policies shape the environments we live in. In the US, subsidies favor processed crops like corn and soy, making junk food cheaper and easier to make than fresh produce. Canada has been more proactive with labeling laws and sugar taxes, helping prevent some of this. Looking into India gives us another lens. It's facing a double burden of undernutrition, yet also obesity, often in the same communities. As urbanization increases, processed and fast foods are replacing traditional diets, leading to this complex issue. Cultural shifts are also part of the story. In India, rising incomes and Western influence has led to higher consumption of sugary drinks, fried snacks, and even screen time, especially among children and teens. Canada has shown that investing in prevention can work. From food guides to Indigenous-led health programs, they're taking a more holistic approach. The US has examples of this too, but they're often local or nonprofit driven, not at the national level. Policy change is powerful. When countries mandate clear food labels, restrict marketing to children, and support physical activity in cities, obesity rates do go down. These changes take time, but work. It's not either or. It's both personal choices and systemic responsibility. People need access, education, and support to make healthier choices, and the system needs to make those choices easier and affordable. This isn't just about awareness either, it's about action too. Whether you're studying policy, healthcare, or education, we all have a role to play in advocating for a healthier community. The obesity crisis is global and growing, but with coordinated policy, community involvement, and a shift in how we think about health, change is possible. The weight of this issue doesn't belong on individuals alone. It's something we all share. Thank you.